Hello and welcome to our YouTube channel. If you or someone you know struggles with persistent constipation that just won't seem to go away, you have turned in to the right place. Today, we are diving into a groundbreaking study that explores how a little known nutrient in your diet could be the key to managing chronic constipation. Now, constipation is more than just an occasional inconvenience. It's a widespread issue affecting millions globally. In fact, about 15% of people worldwide, which equates to around 1.2 billion individuals, deal with this condition. In the United States alone, around 16% of adults, approximately 53 million people, face the challenges of constipation. So, why is this important? This video is based on a pioneering population-based study that uncovers how a specific micronutrient might be the game changer you have been looking for. Stay with us as we unravel the secrets behind this essential dietary element and how it can potentially transform your digestive health. What is constipation? You may ask. Constipation, as we know it, is when bowel movements become infrequent or difficult, leading to a range of uncomfortable symptoms. These can include hard, straining stools, the sensation of blockage, a feeling of incomplete evacuation, abdominal discomfort, bloating, and sometimes even needing extra help to go. In today's fast-paced world, changes in lifestyle and dietary habits have contributed to a rise in functional constipation, impacting many people's quality of life. But here's the good news. In this video, we are not just highlighting the issue, we are also giving you practical solutions. We will introduce you to key ingredients rich in a specific micronutrient that can help manage and even control chronic constipation. These are easy additions to your diet that could make a significant difference. Stay tuned to discover how these powerful foods can support your digestive health and improve your overall well-being. Medical conditions associated with constipation. Before we dive into today's topic, let's review some important medical conditions linked to constipation. First, colonic obstruction. Chronic constipation can lead to blockages in the colon, that is, the large part of the intestine, which might require medical interventions or even surgery to address it. Next, hemorrhoids. Persistent straining can cause the veins in the rectal area to swell and become inflamed, resulting in hemorrhoids. If you are interested in learning more about professions that are commonly associated with hemorrhoids, be sure to check out our recent video on that topic. Colon cancer is another concern. While constipation itself doesn't directly cause cancer, it is linked to a higher risk of colon cancer because of the prolonged exposure of the colon lining to waste products. Lastly, urinary tract infections, UTIs. Severe constipation can exert pressure on the urinary tract and bladder, potentially leading to urinary retention or infections due to incomplete bladder emptying. Now that we have covered these important connections, let's jump into the fascinating study we have lined up for today. The study. The research we are discussing is titled The Association Between Dietary Vitamin B1 Intake and Constipation, a population-based study published in BMC Gastroenterology by Du and colleagues. This study explores how enhancing your diet with vitamin B1, also known as thiamine, might influence chronic constipation. Study methodology. Over a period of approximately 4 years, the study collected detailed dietary information from participants using 24-hour dietary records. The trial included 10,371 participants aged 20 and older with 1,123 of them identified as having chronic constipation. The researchers then conducted a statistical analysis to examine the relationship between dietary intake of vitamin B1 and the occurrence of chronic constipation. Simply put, this study aims to shed light on how adjusting your vitamin B1 intake could potentially help manage and reduce symptoms of chronic constipation. Outcomes of the study. The results of this study are quite revealing. It turns out that a higher dietary intake of vitamin B1 or thiamine is significantly associated with a reduced risk of constipation. Specifically, the data showed that increasing vitamin B1 intake was linked to a lower likelihood of experiencing constipation. Here is a fascinating detail. The more thiamine individuals consumed, the less frequently they experienced constipation. This effect was especially notable among men without hypertension and individuals without diabetes mellitus, with all results showing p-value less than 0.05, which is significant. Another key finding was that women experienced constipation about twice as often as men, indicating that being female is an independent risk factor for constipation. These insights highlight the potential of vitamin B1 as a powerful tool in managing constipation and underscore the importance of dietary choices in digestive health. How does thiamine work its magic in constipation control? Well, thiamine or vitamin B1 is a powerhouse when it comes to digestive health. It plays a crucial role in the proper functioning of the nerves and muscles in the gastrointestinal tract, which are responsible for the rhythmic contractions that propel food and waste through your system. So, how exactly does thiamine contribute to this improvement? It turns out that thiamine, yep, you heard me right, helps regulate neurotransmitters like acetylcholine, dopamine, and serotonin, key molecular messengers that coordinate contraction and relaxation of intestinal muscles. By influencing these neurotransmitters, thiamine enhances bowel movements and helps alleviate constipation. Interestingly, studies have shown that patients with irritable bowel syndrome, an issue often linked with both constipation and diarrhea, benefited from dietary supplements that included vitamin B1, B2, and B6. After just 6 months, these patients experienced significant reductions in abdominal pain, bloating, constipation, and the fluctuations between constipation and diarrhea. With such a profound impact on digestive health, it's no wonder that this often overlooked micronutrient can be so effective in managing chronic constipation. Best dietary sources of vitamin B1. As promised, let's dive into the top food sources of vitamin B1, and remember, these are listed in no particular order. 1. Pork tenderloin, one of the richest sources of thiamine. Lean cuts like pork loin or tenderloin are packed with vitamin B1. If you prefer, you can substitute pork with chicken breast, which is also a great option. 2. Turkey breast. Lean and nutritious, turkey breast is another excellent source of thiamine, making it a healthy choice for boosting your B1 intake. 3. Fortified cereals. Many breakfast cereals are fortified with thiamine. Just check the nutrition labels to find those with the highest amounts. 4. Sunflower seeds. These are not only a convenient snack, but also a good source of thiamine. Plus, they provide healthy fats, making them a great addition to your diet. 5. Legumes. Beans, lentils, and peas are fantastic sources of thiamine. Black beans and navy beans in particular are loaded with vitamin B1. 6. whole grains. Foods like brown rice, oats, and whole wheat products are rich in thiamine. Choosing whole grains over refined ones helps boost your B1 intake and supports overall digestive health. Incorporating these vitamin B1 rich foods into your diet can help ensure you are getting enough of these essential nutrients to support your digestive health and keep constipation at bay. By now, you have seen how this essential nutrient can significantly impact your digestive health. Remember, a balanced diet can be a powerful ally in maintaining overall wellness. If you are dealing with constipation, consulting a healthcare professional for tailored advice is always a good step. If you found this information useful, be sure to hit that like button, subscribe for more health insights, and share this video with anyone who might benefit. Thanks for exploring the incredible role of vitamin B1 in managing constipation with us. Until next time, keep exploring and stay curious on your journey to better health.